The biggest advances in cardiac surgery are about what we're not doing. We're now able to treat many patients without opening their chest and without even putting them on cardiopulmonary bypass. We can now do valve replacements and valve repairs through an artery, usually in the leg. And we're able to replace an aortic valve, which is probably the most well-developed of these advances, just through a catheter that we put up through the leg artery. We're now able to also replace the mitral valve in that fashion. And there are numerous technologies now in trials to repair the mitral valve, either using a leaflet type repair or an annuloplasty type repair, which is where we kind of close down the dilation of the frame around the mitral valve to stop it from leaking. And these advances are unprecedented in cardiac surgery, and they allow us to work closely with our cardiology colleagues in order to get the same type of results we're getting with open heart surgery, but without the traumatic recovery that's required after heart surgery. There are numerous mitral valve devices in trials now that are able to grab a leaflet of the mitral valve that is no longer supported in the correct way and doing something that we call prolapsing, where it's going too high up and allowing blood to leak. And we can now, without opening the sternum and without going on bypass through just a small incision on the side of the chest, we can put a device into the heart, grab that leaflet, and then adjust that tension on that stitch in order to pull that leaflet down to the proper level and keep that valve from leaking. These devices are not approved yet in the United States, but they're in trial and have very promising results. And there are other devices that in a similar manner can put a band around that mitral valve and decrease the dimension of the valve, which can also stop it from leaking. We already have the capability to take the type of valve that we've been implanting surgically for many years and put it inside a catheter and then just release it inside of a diseased aortic valve, and it just takes over, and those patients almost immediately, within a few days, feel much better. These advances, I think, are going to help broaden the number of patients that we're able to treat safely, and also just allow patients to get back to their normal lives much quicker after being treated. It's an amazing time in cardiovascular medicine.